Now, as compared to the rest of the world, there's a higher risk on the African continent of people suffering from preventable diseases due to limited access to healthcare. Africa Vaccination Week aims to raise awareness on this issue by highlighting the importance of vaccinations in preventing diseases and promoting health. ProfMed spokesperson Dr. Moratwe Masima joins us for more on this conversation. Good evening, Doctor. Thank you very much for joining us on the late edition. Just talk us through, firstly, the significance of Africa Vaccination Week for the benefit of those who might not be aware.
Good evening. Thank you so much for having me. So the African Vaccination Week runs from the 24th of April until the 30th of April. It's a very important week that we need to celebrate and also pay more information to the public, is because mainly in South Africa, we are suffering from a whole host of diseases. And as you know, vaccinations have actually helped us beat these diseases, from measles, polio, as well as smallpox. The statistics actually show that about 154 million people have been saved from deadly diseases globally for the past 50 years as a result of vaccinations. So it really just shows how important it is to close the socioeconomic gaps that we do have in South Africa as well.
Now, the theme this year is immunization for all is humanly possible. It's essentially self-explanatory, but can you expand on just the importance of this theme in achieving the targeted 4 goals?
Yes, so what it's all about is really pointing back to healthcare and how important it is. We have forgotten that healthcare is actually a human right, and a lot of people don't get this basic need. I work in a government hospital and clinic, and I see it every single day because we don't have enough resources sometimes, and at the same time, we also have a shortage of staff. So it's really important that the government as well as the private sector can somehow marry and work together so that we can actually go into the really destitute areas of South Africa, you know, the rural areas, the townships, where there's so many people that are suffering from a lot of comorbidities. And I think that it's important that we really do expand on this week, because a lot of people aren't aware that they can actually get certain vaccinations at the clinic or the hospital. A very important one is the flu vaccination, for example.
Yeah, I'm glad that you also touch on awareness there, that some might not necessarily be aware, because, Doctor, there has been progress, but challenges persist in reaching children on the African region. So my question is really essentially, is it a resources issue or an awareness issue, or perhaps even both?
To be fair, it's actually both. I've worked in both the public and the private sector, and I can definitely say that a lot of patients do struggle to get to the clinics when it's necessary. A lot of our population actually is dependent on the government. About 84% of our population does not have medical aid. And these are the very same people that walk to clinics. These are the very same people that use taxis. And a lot of the times, they just don't have the money to get to the healthcare facilities. And on top of that, when they do get to the healthcare facilities, there's long lines, long queues, and a lot of them are told to come back the next day. And as a result of this, we really do lose a lot of critical patients in these under-resourced situations. In the same breath, there are quite a lot of, I would say, taboos or myths that some patients do come with about vaccinations or any other medical procedures. And I think that I do get quite a lot of questions from patients about what we're putting in their bodies. And I'm really happy that they ask me these questions, because it just shows that people want to know what's going on. And I think that after the COVID vaccine, people are more aware that there are some side effects with some of the medications, and it's important that we do talk about it.
Now that you touch on COVID, how much of an impact did it have on the program to increase immunization? Because most of the focus had been shifted to that pandemic, where it seems that other programs really were lagging behind.
Yes, so it's odd that the COVID vaccine actually showed a lot of issues that we have in our healthcare system. A lot of information wasn't relayed to the public in a more concise way. And I think that a lot of people were getting a lot of information from social media. So Facebook, WhatsApp messages. I was getting so many messages from even my mother sending me misinformation. And I think that it really points to the fact that that we need to hone in on the people that are going to be explaining things and educating the masses, because at the end of the day, it does need to be somebody that's knowledgeable on the topic. And in the same breath, because of COVID, there were a lot of backlogs with other immunizations. Because of the fact that people couldn't go to the clinics, we were still isolating at the time. And I think that it also caused quite a lot of vaccine hesitancy, because quite a lot of people did experience some side effects. And as a result, people are now a lot more scared to actually get vaccinations.
I love the fact that you mentioned that your mom was actually sending you most of the misinformation, which is really the story of many young people's lives, where you constantly have to correct your parents. There are family groups where throughout the day there's always misinformation in those groups, and you don't want to be the smarty pants that tells them, no, this is incorrect. But most certainly your mom did benefit, given that you are a qualified medical doctor. Doctor, thank you very much for joining us this evening, though. That is Dr. Moratwe. She is from POFMED. Her surname is Masima.